Dear students, today we'll discuss a specimen which is very commonly seen. It commonly may be kept as a oxy, viva they will keep, and understandably a condition which is commonly discussed as a long case, short case, and oxy. So what this condition in this specimen is, look at that, very thick vault. See thickness, look at the thickness. And it's a gallbladder specimen. See there stone is there. This is the Hartmann's pouch. This area is called Hartmann's pouch. And all of you know that Hartmann's pouch is anatomically infundibulum of the gallbladder. Pathologically, it is called as Hartmann's pouch. So much thickened. See that? This is a specimen of fibrotic, thickened, fibrotic, non-functioning. It won't be able to dilate. So this is due to chronic cholecystitis. So specimen of gallbladder which shows the features of chronic cholecystitis, thickened, fibrotic, non-functioning, sunken, all those things. And sometimes deep mucosa buries into that, and that is called as Rokitansky-Ostov sinuses. So often asked as a MCQ also. Rokitansky-Ostov sinuses are seen in, we should be able to answer, seen in chronic cholecystitis gallbladder. Like that options may be there. So your answer should be chronic cholecystitis gallbladder. And again, I am also reminding you to go through my earlier lectures where I have discussed about gallbladder operative surgery specimen, gallstones also. You can scroll back to lectures where related to gallbladder it is being discussed, so that you can go through that and you can correlate here also. So this is the typical look chronic cholecystitis, because treatment is always cholecystectomy, but before that you have to do ultrasound abdomen, you have to do CCT abdomen, so how much gallbladder is thickened, and the CBD stones are there, liver, what is the situation. So ideally you should do CCT abdomen, you have to do liver function test, serum amylase lipase, because maybe association of pancreatitis, which may be the cause for that. So you should have the idea about that, and prothrombin time, INR, and other essential hematocrit evaluations you have to do. Then eventually treatment is laparoscopic cholecystectomy ideally. So if you find difficult on table to dissect and because of the adherent gallbladder, then you can always do conversion, but always prior to the surgery inform the patient party and take also consent for the conversion. That's very essential legally also. And again important is complications it can cause Mirizi syndrome, you know that, cholecystocholedochal compression and fistula, grading as there ABCD like that, 1, 2, 3, 4, 5. Now new one on 5 is there, and that is also often requires open surgery to conversion. And carcinoma gallbladder can occur in a long-standing gallstones. That's why northeast part of the India, like Bihar, northeast area, the gallstones are very common, and so gallbladder carcinoma is very, very, very aggressive carcinoma is a gallbladder carcinoma, remember, and with the poor lifespan and high mortality. So these are the different complications which you have to remember in chronic cholecystitis. So features are vague pain, sometimes obstructive jaundice, some recurrent episodes of acute episodes in a background of chronic cholecystitis. That is also there. So they will have a Murphy's positive sign when they present as acute, or Moynihan sign, where you feel when a patient takes a deep breath or the zenith of the inspiration, patient have a severe pain, winces with the pain. It's called inspiration arrest. Typical word is inspiration arrest on the zenith of the inspiration. Patient winces with the pain on the zenith of the inspiration. Often it is called as inspiratory arrest. That's what Murphy explained this sign long ago. So management is, I already discussed all this management aspect. Treatment is laparoscopic cholecystectomy with the consent for open conversion. So that is about chronic cholecystitis. Always you can go through my SRB's manual of surgery for detail about the gallstones, chronic cholecystitis, entire thing about the gallbladder, laparoscopic or open cholecystectomy, details about it. And also you can go through my clinical methods in surgery where pathology specimen, gallbladder specimen is there, which you can always have a look on that. So that's very important topic everywhere. So again, I'll request you to have my SRB's manual of surgery and SRB clinical methods in surgery, which will give full information about these topics. And again, I request students, please subscribe my YouTube channel and share my channel with your friends, colleagues everywhere, and press the bell. And also, you got so many videos you can day to day, anytime you can get the lectures, brief lectures, which will have images, clinical science, clinical cases, instruments, specimens, operative surgery, post-operative status, complications, so many different categories. You can always go through my playlist and view this one. Lot of lectures are there, brief 5 to 8 minutes, 10 minutes, so that daily you can, brief period, you can learn surgery, so that increase or upgrade your surgical knowledge. And also join regular live sessions, which we will have a detailed discussion about the different long cases, case discussion with interaction. Some students are presenting, and you can with the different senior faculties in the same platform, so that you can put your doubts in the chat box. I get the answer from us, and also join live session with the better knowledge of clinical discussion. And also you will get a certificate if you join live, and it will be very, very useful for your future career. And what is this instrument is? Students, please write the right answer. I'll acknowledge your answer. Put it in the comment box. So what is the instrument is? Trocar cannula for hydrocele, trocar cannula for fluid tap, trocar and cannula for ascetic tap, then is brain cannula. Put the right answer, please. What is this instrument again is? So Murren Baker's forceps, Lane's forceps, Alice forceps, Babcock's forceps. Again, put the right answer. I'll get back to you. Again, I request you join my YouTube channel, subscribe, press the bell, and share the video with your colleagues. So quotation of the day, students, don't lose hope always. There will be ups and downs. You may lose so many times. Never lose patience. That's also important. Always patience and hope. These are the two things to make you to go up, shine up, grow up in your professional life, everything. So hope and patience is very, very essential. Don't get angry so easily, and that's the most important thing. So make your calmness always pleasant. That is the quotation, which is again very useful for surgeons. And students, request you to go through my SRB's manual of surgery and have it. It covers CBM syllabus entirely: general surgery, gastrosurgery, urology, specialty, other specialty, cardiothoracic, neurosurgery, endocrine surgery, thyroid, breast, and parathyroid, and adrenal, and so on. And with the instruments, operative surgery, and basics, everything as for CBM syllabus. And also quotations are there, lot of illustrations and photos are there, figures are there, with the management concepts are there, principles are there. So everything is covered with the briefly instruments for students, and adjuvant therapies, and images, and anesthesia briefly, and which all covers under surgery for undergraduates. And of course, different operative surgery procedures also briefly, and audit and newer concepts also there. You can go have book, you will have you can learn surgery entirely properly, and also go through my clinical methods in surgery current edition. It is it's got a lot of photos, illustrations, photos mainly, and how to examine different patients, starting from the general examination to different conditions like hernia, breast, thyroid, varicose vein, arterial disease, short cases, hydrocele, abdomen mass, different swellings. Everything is covered briefly orthopedic also. And it also have got a specimens, instruments, briefly images also, X-rays and CT scans, which will be useful for your Viva, Oxy, and cases presentation. This is with detailed case presentations, and with video of each case presentation with the QR code in each chapter that will show the proper examination method. And also differential diagnosis given in each chapter with the tabular form. It will be very, very useful, very essential book for your clinical exam and clinical learning. So please purchase and have it. It will be very, very useful to you. My operative surgery 3rd edition has come, and it is a 2-volume book, extensive book with 10,000 literature and photos. Gives a step-by-step operative procedure for all surgeons and postgraduates in surgery. And my atlas of tissue approximation, 100 pages atlas with the video, how to different suturing, how to do with the proper principles and explanations of different suturing technique. It will be very, very useful for beginner, learner, or whoever learns surgery, suturing. It will be very useful, understandable for everybody. Again, please have it and go through it. And my DigiNow lectures are through JP Publishers. Entire CBMS syllabus, everything for 220 hours lectures are covered with the examination of different exam cases and also specialties, operative surgery, instruments, specimens, images, everything detailed, and wherever neat MCQs that also discussed. All things, everything is covered as for CBMS syllabus. It will be very, very useful. Again, please subscribe this one, purchase for 1 year. So it will give complete information of surgery and how to face exam. Everything will be very useful to you. So again, you can always go through that DigiNow lectures. I again request subscribe my YouTube channel. Daily lectures, go through it, brief 5 to 10 minute lectures, and answer MCQs, and there is a quotation also. Always try to answer 2 MCQs which is present there in the lecture, and also join live sessions whenever is there at regular intervals to increase or upgrade your clinical knowledge and presentation experience as such. So students, I hope you have understood this lecture very well. Thank you so much.